Hello dear friends, this is a case of a 92-year-old woman who presented with abdominal pain, distension, vomiting and pain between the right inguinal and right upper thigh. CT scan was done and we can see that there is significant dilatation of the small bowel with air fluid levels. We can see that the rectum is empty. There is no dilatation of the large bowel. Here is the rectosigmoid colon. Here is the descending colon. Here. Part of the transverse colon collapsed again. At this point is the rectum, almost collapsed. This is a small bowel loop. This is the rectum. This is the terminal ileum, which is also collapsed. So the stenotic point is somewhere in between. And if we go a little further down, we can see that there is this finding. This is called obturator hernia. This is a right obturator hernia containing a small bowel loop which is collapsed. If we go a little further up, we can see that there is a stenotic point here and upstream dilatation of the small bowel. The terminal ileum is collapsed. An obturator hernia is a very rare condition. And abdominal contents protrude through the obturator foramen in the pelvis, causing intestinal obstruction, particularly in elderly and often underweight women. And the symptoms are usually non-specific, such as abdominal pain, nausea, vomiting, but the classic sign is called Hauschip-Romberg sign. It is pain in the medial segment of the thigh, right, like in this case. Sometimes diagnosis is clinical diagnosis is challenging. That's why CT scan can give the answer in the clinical query. Here the finding in coronal view. The right obturator hernia and small bowel obstruction. Dear friends, thank you for watching this rare case. See you the next time.